One, good morning, everyone. My name is Jacinta Mbono. My presentation is on activity 11, module 7, panic disorder, psych 8724/8A, cognitive, emotion, and motivation. What are the psychological process involved in panic disorder? The psychological process involved in panic disorder are, are known as the body fight or flight response, neurotransmitter, and the brain amygdala. Fighter or flight response. This is referred to how the body reacts to a danger resulting in a sudden surge of chemical through the body system. The brain amygdala assists in the process of strong emotion, such as fear, unexpected event. The neurotransmitter inhibitory extracellular function include predicting the implication of adenocellular symptoms in anxiety and substance effects. The role of sympathetic and neural peripheral sympathetic nervous system. The key function of the sympathetic nervous system is to activate the fighter or flight response in threat or stressful situation. When activated, the sympathetic nervous system can link to psychological response. As we can see in this little picture here, we see the fight and we see the flight where the person is running because the sympathetic nervous system had been activated, and it just caused the psychological thinking, our neural functioning to now move, and our eye will now rise with a force. So they dilute the pupil, it will now look so sharp. It will open, we dilute the pupil, and the heart will start beating so fast, and the muscle will increase, everything will start working at the same time. And the lightness and serotonin, the sweat gland, will now increase. The person will be sweating uncontrolled. The sympathetic nervous system controls the body fight-or-flight response, where the parasympathetic nervous system is a part of automatic nervous system that balances the sympathetic nervous system. The parasympathetic nervous system also helps to control the body response during the period of resting. So the neurotransmitter, what are the neurotransmitter and the hormone involved in the panic disorder? The neurotransmitter and hormone are two types of chemical gasture molecules that animals produce. They are responsible for behavior and attitude of the organism, like serotonin, norepinephrine, which tend to cause symptoms of panic disorder. Norepinephrine is a neurotransmitter that is released during the fight or flight reaction, while epinephrine is a hormone released during the body stress response along with non-norepinephrine. The serotonin is a neurotransmitter that is connected with mood, sleeping, and eating appetites. So, fighter, flight, and freezing response. What are the fighter flight? As we can see in this picture, when they see the gesture of the arm, so it's like a sudden attack. And you see this picture, this one is flight, is running, and this one is running in a different way. Fighter flight, you fight for your life. And this one here standing still is freezing. It's like a shock. Doesn't know what to do at this time. So it become a sudden, I don't know where to run to. So as we know that fighter, flight, freezing, there are three distinct psychological reactions that the body initiates in response to perceive a danger or threat. they are automatically applied for survival mechanism. They are body mechanism that we use as defense mechanism. So the fighter, flight, or freezing response can assist fighter in contextualizing a person's reaction and develop strategies to manage their fear effectively. So we go to potential causes of panic disorder. What are the potential causes? So we have some potential causes of panic disorder. So where potential causes of panic disorder is associated with unexpected incident or event without a proper explanation. We can see sudden attack of intense fear. We can see traumatic events such as childhood abuse. It can be parental abuse. It can be sibling abuse. It can be work area abuse. It can also bullying at school, bullying at job. We can also have, there's also sexual abuse. People can be sexually abused and it's a trauma. So it's also a panic. The person will be afraid of associating with people. So reaction of substance use such as alcohol, caffeine, cocaine, and other illegal drugs impact the system. So medical condition, we also see such as cardiac arrhythmias, asthma, and hypothyroidism. And we also have brain chemistry, which is an imbalance of neurotransmitter in the brain. Personality, personality factors. We also have the tendency towards negative emotion, can also be one of them. So we have combinability of panic disorder. What are these combinability of panic disorder here? We have general combat disorder include alcohol use disorder, other anxiety disorder, which we can see in this small picture here. We have general anxiety disorder. We have major depression disorder. We also have panic disorder. We also have substance disorder, which is in the middle that can cause all these dismentary disorders. We also have post-traumatic stress disorder and obsessive compulsive disorder, social phobia. We also have social phobia. People can be in a group. They're afraid of being in a group. They're afraid of going outside in a public. And we have medical problems, which is chronic obstructive pulmonary disease, irritable bowel syndrome, and hypertension. So we move to evidence-based treatments. What are the evidence-based treatments available for panic disorder in clinical psychology? We have several of them, but we have to discuss few of them here. We have cognitive behavior therapy. The patient learn various ways of thinking, behaving, and reacting to their feelings during period or before a panic attack. We have pharmacotherapy. Well, the pharmacotherapy is where medication that are available for treating panic disorder, such as antidepressants and monoamine oxide inhibitor. The medication are being reviewed to see the effects, how it's going to function, the effective of it in when I'm treating the panic, the disease or the disorder. We also apply breathing technique. We emphasize on breathing technique that will help to reduce the symptom or improve the symptom, the way to manage the symptom without complication. So we move on to medication available. What are the medication available in treating panic disorder? There are several medication disorder, but we have few of them that we need to talk about. And we have this benzodiazepine. Benzodiazepine is known as a fast-acting sudaizi that can relieve anxiety symptoms, but it can also be used in management of sudden attack and behavioral disturbance, like aprepilant and the clozapam. They are used in calming the mood or the emotion. And we have metroxapen. Metroxapen is an inhabit neurotransmitter or neuroepinephrine and serotonin used for release of depression symptoms. We have leptamine. Leptamine is effective in control of bipolar disorder. It calms the hyper, that is in the hyper symptom in the bipolar. We have fluoxetine. Fluoxetine increase serotonin level in the brain, so it helps to increase the level of serotonin in the brain. We have fluoxamine used for treating panic disorder and social phobia. We have hydrolysis. Hydrolysis is release anxiety tension associated with psychoneurosis, a joint in organic disease of anxiety when it's manifested or when it occurs, when anxiety occurs. All right. We move on to therapeutic recommended. What are the therapeutic recommended for treating this anxiety? We have several of them that have been, like 8 of them are under cognitive technique. We have cognitive restructuring, and we have to exploit the task, and we have breathing control, muscle relaxation, grounding, mindful training, general and smart goals. Smart goal, the person can you can just do something you know that you are good in doing it, either music, dancing. General, you can put on this sign and symptoms on what you observe before the attack or after the attack. Mindfulness, you just meditate on something that makes you focus, you concentrate, you put focus on things you do without being distracted. Grounding, you learn different styles, different lifestyle, different skills that will motivate you and prevent you from being attacked easily. So more relaxation, you relax your mind, you do like yo-yo or dancing. And we'll also move to breathing technique where you can relax your mind and learn how to control your breathing, your airway, how to present your airways, and exposed to the task. So you can just summarize the person into the task. Like if somebody is afraid of elevator, you will now help the person to be using the elevator constantly with a group of people, and the person will get used to the elevator, and that panic will now reduce. Or somebody that doesn't like lizard, you can bring lizard like a pet. You will now use the lizard as a pet. The person will keep on playing. As for me, I didn't like cats, but now my children like cats, and now cats, I'm used to cats now. Formerly, I don't like cats, and I don't go closer to them, but now the cat is in my house and now used to cats. So it's one of exposing to the task. We expose ourselves to what frightened us or what gave us attack. So we also have acceptance and commitment therapy. If you accept that you have a problem and you commit to the task that's given to you to manage that problem. We also have family focus, where the families get involved in the in the um, in the therapy, so they will learn what to do during this attack or when the attack occurs. So support they need. What are the support they need? So the person can communicate effectively, effective communication with people the patient trusts about his experience or feeling associated with the health condition. We talk to the healthcare provider about the signs and symptoms the person experiences in daily basis. We also take medication as directed by the healthcare provider and eat a healthy meal. And the cognitive therapy is also applied. We have anti-anxiety medication. We develop meditation. We also routine meditation where the person can do some things. We avoid some kind of substances. We avoid some kind of alcohol use and live a good, better, healthy lifestyle, engage in social activities and healthy activities, social activities. And that comes the end of my presentation. And here are my references. Thank you. Thank you for listening to my presentation.